We're here with Dr. Mandeep Johal, dentist extraordinaire, to talk about oral health in children. Of course, summer is coming up, Dr. Johal, and we want to know what some important hygiene hacks and tips we can give parents and guardians out there looking to maintain a routine with their kids.
Well, summertime, as you know, is the busiest time for parents, especially if you're traveling. I would find that's when a routine really drops. So I would advise keep it simple. Have manual toothbrushes and have like a travel size toothpaste. And I love these little flosses. The whole family can use them. Obviously not the same one, but the whole family can use them. So keeping it simple is the best way you can do for summertime and routine.
Now, how old should parents start to consider bringing in their children to visit a dentist?
So the American Academy of Pediatric Dentistry recommends from age 1 to when they first get their first tooth is around 6 months time. However, I am a general dentist, but I do treat from 0 to 100. So I see little ones that are like 5 days old. And the reason I do that is because I want optimal facial growth in the first year of life. And if you think about babies, the first year of life, their face is growing exponentially because, you know, babies, their heads are disproportional to the rest of their body. There's a reason for that. So I just want to make sure it's optimal.
Yes.
So I work with a lactation consultant as well. So she'll make sure babies are feeding either on the breast or on the bottle.
Okay.
And then I will make sure that their tongue function is where it should be and the baby's breathing through the nose so we can set them up for the rest of their lives.
Oh, fantastic.
Yeah.
Now, of course, sometimes it's a little bit difficult to encourage little ones to brush every day and a couple of times a day. Can you talk us through some products that maybe parents can use if they have a bit of a fussy kid at home?
Okay. That is challenging, especially with little ones. I would encourage keeping it really fun, having like a reward chart that I just created this summer for my patients, gamifying. There's lots of apps out there, just really making it fun, and have maybe even toothbrushes with characters that they like. Like my son loves Spider-Man, having a Spider-Man toothbrush, or little kids love Bluey, getting Bluey on their toothbrush, anything to just make it really fun for them.
And what about these timers?
Oh yeah, these cute little timers, thank you. So just encouraging, like, they shouldn't be brushing for 10 seconds. They need to be brushing for little ones, especially for a minute.
Okay.
And maybe when they're around 11 or 12 for 2 minutes.
Okay.
But making it fun as possible for little ones.
Absolutely. Now, I want to talk about some links between oral hygiene and behavior or overall health in children. Can you talk to me about some of those connections?
I'm so glad you asked me about that. So poor oral health doesn't just impact teeth. So when a kid sits in my chair, we are looking at their lip posture. Are their lips fully sealed? Are they breathing through their nose? Do they have dark circles underneath their eyes? And when parents ask, you know, why do I care about that? Because if the child is mouth breathing in my chair, I know they're mouth breathing throughout the day as well. Now I know that kid is at high risk for cavities, and they're more likely to build up plaque and calculus on their teeth as well. And they're not, like I already mentioned the cavity part, but if they're mouth breathing, I can guarantee you they have poor quality of sleep. So it's not how much sleep a kid gets, it's the quality of sleep. And now think about that. That poor quality of sleep is gonna affect their behavior.
Okay.
So when I tell parents this, they're like, wait, I'm coming here for a dental checkup and you're asking me and talking about sleep, because it's gonna affect their behavior throughout home and at school.
Okay, thank you, Dr. Johal, for some amazing tips for summer for kids getting ready for a change in routine.
You're very welcome. Thank you for having me.